please?
I'm 28.
Okay, thank you. So I see that you are here to discuss your test results. Am I right?
Yes, doctor.
Okay. So before we do that, could you tell me how's everything going on with you?
Yeah, everything is okay, doctor.
Okay, any problems so far?
No.
All right. Do you mind me asking, is this your first pregnancy?
Yes, doctor.
Okay, all right. And are you excited about it?
Yeah, sort of.
Uh-huh. Is everything okay with you?
Yes, doctor. It's actually an unplanned pregnancy.
Oh, okay. So you're not very happy with it, right?
Yes.
Mm-hmm. And how does your partner feel about it?
Actually, doctor, I don't know about the father.
Oh, okay, okay. So this is something that's worrying you.
No, I'm really concerned about my baby. Is everything okay? And I want to know about the test results.
Uh-huh. All right. Yeah, sure. We can do that certainly. So your test results came back and everything is okay. Like we did your full blood count, and that is normal. The a few some tests regarding the viral infections and everything, and that's normal as well. We did your ultrasound scan, and it shows a viable baby. Yeah. So
Okay.
yeah, everything is okay with the pregnancy itself. But to be honest, I'm a bit worried because I see that you're really concerned.
No, doctor, I was just worried about the test. That is, my baby is fine and everything is okay.
Yeah, yeah, absolutely. The baby is absolutely fine. Um,
Okay.
do you have any other concerns that you would like to discuss with me at the
No, doctor.
moment? Okay. So, can we can we talk about the things that you should do since now that you are in your first trimester and you're about to go to the second one? Do you have any idea about what the trimester thing is?
Yes, doctor, I know that it's the first 3 months.
Okay, so soon you will be moving to the second trimester. So, in fact, you are at 14 weeks and you are about to go. You are in the second trimester. So there are a few things that I would like to discuss with you regarding how your diet should be and the exercise and everything. So, I will be asking you a few questions regarding your lifestyle. Would that be okay?
Okay.
Okay. So, tell me, what's your diet looks like? What do you eat in a day normally?
Well, doctor, I don't eat healthy. I eat a lot of processed food
Oh, okay. And what's the reason for that?
because I usually don't cook
Mm-hmm. Okay. And do you work?
sometimes.
Uh-huh. All right. So let's see what we can do about this one because I would really like to advise you regarding how we can, get around getting healthy, proper food. What about smoking? Do you smoke?
Yes, doctor.
Since when?
It's been many years now, doctor, but I tried to quit down, but it's very hard.
Yeah. Yeah. People who smoke, they find really hard to cut it down, but it's really important that you should, and we'll certainly talk about this one as well. And what about
Hmm.
alcohol? Do you drink alcohol?
Yes, doctor.
Okay. And could you tell me a bit more about that as well?
I drink one bottle of wine every day.
Every day. Don't you think that this is too much?
Mm, maybe.
Yeah. This is too much actually. And what about exercise? Do you exercise?
No, doctor.
Okay. Are there any medical problems, any long-term medical problems with you?
No, doctor.
Okay. And are you on any medication?
No.
And are you taking any supplements for your pregnancy? And have you taken any supplements for your pregnancy, like iron or folic acid, especially?
No, doctor.
All right. And are you on any kind of over-the-counter medication or any herbal ones?
No, doctor.
Okay. And what about, I'm sorry to ask you this, but I have to because it's one of the routine questions that we like to ask everybody. What about any recreational drugs?
Yes, doctor. I use cannabis.
Okay. And for how long have you been using that?
It's been 2, 3 years now.
Okay. All right. So I guess we have a lot to talk about. Um, but I would like there's a lot to talk about, but I would like to address a few things first that are really necessary for because I see that you are really worried about how your baby is doing.
Mm-hmm.
And yeah, so I would like to discuss with you about a few things that if you don't do them, for example, if you don't quit smoking, if you don't cut down, in fact, if you don't stop drinking alcohol at all for the time period of your pregnancy, regarding your healthy diet, if you don't do all of that stuff, this is going to really affect your pregnancy. Are you getting me?
Oh, okay.
Yeah. So this is going to be a long discussion, and we can always set in another appointment to discuss about everything in a bit more detail. But let's see
Mm-hmm.
what we can do about it. But before that, would you mind if I examine you?
Okay.
Okay, so I would like to do a quick general physical examination. I would like to do vitals that include your temperature, blood pressure, pulse and respiratory rate, your BMI, which includes taking your height against your weight. And would that be okay?
Okay.
Okay, thank you. So, are there any findings?
No.
All right. Okay, so from the examination point of view, everything seems okay, and your tests are okay. So let's discuss about what we can do about your lifestyle. So first of all, please, can I ask you to just quit smoking because when you smoke, the toxins that you are inhaling are actually affecting the baby as well, and it could lead to some very irreversible damages.
Okay,
Are you
doctor. I will
getting me?
try.
Okay. And regarding alcohol, do you know that the guidelines say that you are not supposed to drink any at all during this pregnancy time period? And I know that this is hard, but
Time finished, Doctor Nabia.
uh, yeah, thank you so much.
Welcome. Okay, so when is your exam?
It's in August, 24th of August. Yeah.
Okay. So we need to talk about few things like your IPS is good. You are really trying to connect with your patient, but you in when you are trying to do that, your structure is a little bit haphazard and disorganized. Like first you were doing data gathering and then you disclose the test results to me, and then you come back again on the data gathering, and then you started counseling the patient, and then you go to the examination part. So you see what I'm saying? The structure
Yeah.
was yeah, haphazard here.
Okay.
And the second thing is that, Dr. Nabia, what was your understanding of the task? I will show
That
you the task again.
sure.
So you see here, there were two things that you were needed to cover. One was that this patient was non-immune to rubella. Okay. And the second thing was that her RH was negative. Okay. So, so what are you saying?
Yeah, no, I get that I've missed a few. Yes. I
Yes.
missed the task for some
So
reason.
Yes, so the understanding of task was not appropriate. Yes, the lifestyle modifications needed to be covered with that patient as well, but there were two other issues that we needed to cover. Okay,
Okay.
so we will start from the data gathering. I will give you a general approach so that other candidates will also come to know about this station. Okay, so
Okay, thank you.
there are few obstetric questions whenever you are having a pregnant patient. So if you will follow them in sequence, you will not miss anything, right? First of all, the first question should be, can you please confirm the age of your pregnancy or the when was the last time you have your menstrual period? Okay, that should be your first question. And the second question should be, how is your pregnancy going so far? Your third question should be, are you having any complications or any symptoms? Here you can ask some closed questions related to pregnancy. And in this scenario, because she is non-immune to rubella, then we can ask few questions about symptoms of rubella as well. Like, do you have any fever, flu-like symptoms, right? Any rash on your body, any morning sickness, any burning urination, or any discharge from your front passage, anything that you want to discuss, right? And then you go to the next question, which should be, have you been pregnant before? And if she says yes, then there are another set of questions like, how many times, when was each pregnancy, what was the outcome, was there any complications, right? So if you follow this sequence, you will not miss anything. You follow the structure, you will not miss anything. Are you following me?
Mm-hmm. Okay. Yeah.
Right? After that, you go to the past medical history, ask about any medications, and past medical history, cover that, and then you go to the lifestyle, and then you go to the social history, right? So because this patient might give you a history that she is homeless, right? So we can also talk about that in the management. And after that, you go to the examination portion. And in the examination portion, you are having a pregnant patient, so you can also verbalize the antenatal examination apart from just vitals and general
Mm-hmm.
physical examination. And you mentioned, sorry, the chaperone along with it. Like, I would also like to examine your pregnant tummy, and I would be having a chaperone with me to ensure your privacy. Would that be okay for you? Okay,
Okay.
so if you're going to verbalize it properly, because sometimes there are some findings, and if you are not going to tell the examiner exactly what you are looking for, you will not get the findings, because they usually have a paper, and they will only hand over to you only when you will tell them what you are specifically looking for.
Yeah.
Okay, and after that you move on to the counseling portion. So whenever you are doing a counseling portion, sorry, management part of counseling, in that, if a patient has come for the follow up, and some of the tests are negative, and some of the tests that you need to talk about, so you can disclose in this way: thank you so much for coming for the visit today, and I have your test results with me, and I'm so glad to tell you that some of the tests are negative, such as we tested your blood for any bug, or if you are having any weak blood, and that was okay. We also did a test to check any infections in your body, and that was also negative. And we also did the ultrasound, and that shows that you are having a healthy pregnancy, which is of 14 weeks in duration, and your baby is in the normal position. So you have now disclosed your normal findings. Now you say, but today we need to talk about two things. That is, we did two tests for you. So can anybody tell me how you are going to disclose the rubella status to this patient? You can unmute yourself.
I can explain
Yes.
it.
Okay.
Okay, we did some blood tests to check for the immunity to rubella.
Mm-hmm.
Unfortunately, we are not immune to rubella virus. Then
Okay.
we checked for your blood type. We found out that you have a type of blood called rhesus positive. And
Okay.
yeah,
What is your plan of action for this patient?
okay, because you are not immune to rubella, would encourage you to avoid people that have rash or immunocompromised people, people whose immunity is low, and elderly people. Then your blood level is normal. You have a normal blood type, but if your partner has a different blood type, we might have to monitor you more frequently and give you a type of medication called Rogam.
Okay. Yes, you are right, Dr. Max. So the first thing is that we are going to tell the patient that she is not having protection. So we checked your blood to find if you are having any protective antibodies against the virus, which cause German measles. We call it rubella. And we found that you are not having protection against this virus. So try to use the layman language that the a patient can understand. So simply that we tested your blood and we didn't find any protection or any protective antibodies against this virus, which causes the German measles. But that does not mean that you have this virus at this time. It means that you might need to take some further precautions because this virus can harm your unborn baby. So we are going to give her 3 sets of advice. First is to avoid contact with any sick person who is having fever, flu-like illness, any rash, or children, or any family, friends, or relatives. So you need to avoid contact with these people. Second is avoid travel to the areas where the measles or the rubella might be, there might be an outbreak of rubella. So avoid travel. And third thing should be that will also be your safety netting, that if you develop any of the symptoms, such as fever, flu-like symptoms, any muscle pains, any rash, then please contact your healthcare provider immediately. So this is how you disclose the first issue, and then you give your plan of action for that. Okay. And there are some further things that we can do for, we can tell this patient. So can we give the immunization to this patient? Can we give MMR vaccine to this patient? Can somebody answer?
No, we
No.
cannot give.
Pregnancy. No.
No,
No,
we cannot give.
live attenuated. No.
Yes, exactly. So we will defer the immunization. We can just give her some general advice, and after the pregnancy, she can get immunization. So I'm going to share the screen so that it's clear for you all. If
Within 72
the
hours
patient,
after delivery.
okay, I'm not sure about 72 hours because I think that is for RH immunization or something like that. Okay, so if before pregnancy a patient is not pregnant, she's trying to conceive, and we check the status in the prenatal counseling, we check the status for rubella, and if it is negative, then we immunize that patient, and we would advise that patient to wait for at least 4 weeks before the conception. So this is the scenario when the patient is not pregnant and non-immune. But if our patient is pregnant, then we cannot offer immunization, and our plan of action would be avoid contact, avoid travel, and report to the healthcare provider if you develop any symptoms. Okay. And after the pregnancy, what we will do, we can give the first dose 6 weeks postpartum, and the second dose there should be at least 4 weeks interval between the second dose. So we can tell this patient, we can counsel that after the delivery of your baby, we are going to give you the immunization against this virus or against this bug, so that you are protected in your future pregnancies against this virus, because it can be very harmful for the unborn baby, especially if it is contracted in the first trimester. Okay, so we can further counsel this patient regarding the immunization. So this is our first issue. There comes our second issue. So how we will disclose this to the patient that she is RH negative? So we can just say that, we checked your blood for a protein called RH factor. The people who are having this protein are said as having positive blood group, and the people who are not having it are called having negative blood group. So we checked it and we found that your blood group is negative, right? So it means that if you are going to have an RH if your baby's blood group is going to be positive, then we will be giving you two injections of protective antibodies at 28 weeks and 34 weeks, and we will follow you up for that. So if the mother is Rh negative and father is Rh negative, then we don't need to give anything. But if father is Rh positive, then we will definitely give anti-D immunoglobulin. But can somebody tell me, like in this scenario, the father is unknown. We don't know the Rh status of the father. What should we do in this scenario?
I think it's better to
We can
give.
check the baby's status of blood group.
Yes, we can do that. And second thing is that we can give the immunoglobulins, because otherwise the consequences are very serious. So the preventive immunoglobulins can save us from that. We can give immunoglobulins to this lady. Okay. Okay. Then there are three things that we always cover in the management. Can somebody tell me what are those which are left? Apart from lifestyle in this station. One is safety netting. The second is we talk about follow-up. And the third thing is we always give leaflets, because in NHS there are leaflets for everything. So we can give leaflets to every patient, right? So when we are covering the management part, you always cover these three things. So I will tell you about the structure. First thing is that if we have a diagnosis in hand, we disclose the diagnosis. Second thing is we explain it, or in this scenario, we disclose her the test results and we then explain what does that mean. And then the next step would be if we need to give her any treatment or any further investigations needed, any referrals for her, any senior involvement. And the last three things would be safety netting, follow-up, and leaflets. So almost all of your stations will be revolving around this structure. You will just modify it, from one station to another. So as I told you that the safety netting in this station would be that we will safety net her regarding the symptoms of rubella that she needs to come, and some danger signs of which can be encountered in pregnancy. For example, any bleeding from the front passage, any tummy pain, then she should come back to us immediately. So this will be our safety netting. And follow up, obviously we can tell that we will follow you up, and we will follow you up in the next antenatal visit, and to look after your baby and to look after you. And I can also give you some leaflets. You can read about the rubella and also about this Rh factor immunization more in detail from these leaflets. And obviously in this scenario we need to cover the lifestyle. So you see there are a lot of things that we need to cover here. We have to talk about Rh, we have to talk about rubella. She is homeless, she is drinking alcohol, she is smoking, she is not having a healthy lifestyle, and also she is having taking cannabis. So it's always good to give a one line or precise your management plan in one line. For example, I'll give you an example in this scenario. Thank you so much for coming for the follow-up today. And today I will tell you about your test results, and I need to talk about two issues today. One is your immune status for the rubella, and the second is for your blood group. And I also need to talk about your lifestyle, especially the smoking and alcohol and drugs. And we will be talking about your diet as well. And I will also talk about, since you are homeless, we will also talk about that. And I will give you some warning signs to look for, and we will discuss about follow-up and leaflets. So this is your one line of management plan. So if you miss out anything now, if you miss the lifestyle, the examiner knows that this person was going to discuss about, he knows that these are the issues, smoking is issue, alcohol and all of this is issue, and he knows that and he was going to talk about that. So you can always, you can save yourself by giving just all of your management plan in one line, as I always say. So you don't need to go into so much details because you don't have much time. So just say, like, smoking is very injurious to your baby. It can even result in stillbirth. So what do you think? Can you quit smoking? We also have some smoking services that we can provide you. It's very important to take a healthy lifestyle and also to quit drinking. And if you want to drink, then please limit it to 1 or 2 units in a week. And we can involve some social services and we can arrange the accommodation for you. I can talk to my senior regarding this. And what's left? The drugs. It is not advisable to take drugs during the pregnancy because it can cause serious effects on your baby. So that's how you are going to cover your lifestyle. Okay, so she can ask one more question from you. Doctor, do I need any further screening or any further tests? Can somebody give me an answer?
I think no, at this point of time, no need of any screening.
Okay. Anybody else?
STI,
HIV. HIV.
HIV.
Yeah, but for that we need to do something in data gathering that was missing.
Needles.
Sexual history.
Sexual history.
She's homeless. She is taking drugs. She doesn't know the father, father of the baby. So we can ask about sexual history, and it might be a possibility that she will give you the history of casual, many casual partners and unprotected sexual history. So we can always then offer her a screening test for sexually transmitted infections and also for HIV. And don't forget the anomaly scan that we will do at 18 to 20 weeks for her, right? So these are all the tests that we can offer her. Somebody is saying that if this is the first pregnancy, no need to give injection. So I think you are talking about that RH thing. So in the first pregnancy, there is not going to be any harm. But if we don't give the protective immunoglobulins in this one, she will be immunized for the next pregnancy. She will develop the antibodies that are not going to harm her first child, but when she will get pregnant for the second time, those antibodies are going to cause the erythroblastosis fetalis disease, in which the fetus develops anemia. Sometimes there is stillbirth, there is jaundice, connectors, and there are a lot of complications. So this is actually a preventive step that we will do in the first pregnancy for the future pregnancies.
Yeah, Dr. Annie, can I ask you something?
Yes.
Yeah, so if this lady, she gave us a history of a contact history, like she got in contact with somebody who's got infection or fever or rashes at home, like some like symptoms of measles, mumps, and rubella. So what can we advise this lady?
Then this will be a high risk pregnancy, because if she is now 14 weeks, and it means that she must have contact in the first trimester. So this will be very high risk pregnancy. There will be there is 85% chances of transmission of this virus to the pregnancy to the fetus in first trimester. So what we can do is we can refer her to the specialist. And because we cannot do anything for her, we can just refer her to the specialist, and she will be monitored more frequently, and she will be managed by the specialist. But this will not be given because we are in GP. This scenario will not come to us like this. But you should know that in first 12 weeks, there are a lot of side effects that can happen in the fetus. There can be cataracts, deafness, there can be heart defects, liver defects, brain damage, and all. And when there is 13 to 16 weeks, then the chances of transmission is 50%. And beyond that, the chances of transmission is 25%. So the first trimester is the most what we can call dangerous one.
Yeah, okay. Thank you.
So in the first pregnancy, it's advisable to give the 2 anti-D immunoglobulins at 28 and 34 weeks. But if it happens that the person is not immunized during her pregnancy, then within 72 hours of delivery, we can give the anti-D injection. This is because that is the time where there will be hemorrhage. There can be mixing of fetal red blood cells and maternal red blood cells, and they can evoke an immune response. So that's why we say that if she's not immunized during the antenatal period, then within 72 hours, she should receive the injection of anti-D. Okay, Dr. Nabia, your IPS is good. You really try hard to connect with the patient, but please don't lose your structure in this process. if you just align your structure, I think you will be fine. And read your task very carefully. Like sometimes in the task there are a lot of findings. A patient has come for of the follow-up, and you have a lot of investigations. So try to categorize them, which are positive and which you need to talk about. Outside the cubicle, you should first try to think that these tests are positive and I need to talk about them, and then you try to memorize the other one that you will disclose to the patient that these are negative. But first focus should be that what you should be talking in the inside the cubicle.
Okay, thank you. That was really helpful. Thank you so much.
Welcome. Anybody has any question? Regarding the PSA screening, as the Puraj shared, there is currently no screening program. There is a screening program for PSA. This is we call as I forgot the name, but